felt very unheard. I felt very alone, even with my husband and my family there to support. Just not being heard by the team that's supposed to be there to medically take care of you and make sure that you're having a safe delivery.
Hey, it's Kevin Deese, candidate from New York State Assembly, District 149. Welcome back to our Black Maternal Health Week series, episode 2 of 3. In episode 1, we heard the story of my dear friend Trisha, who gave birth to precious baby girl Adanma, or Ada, 14 months ago. In this episode, we're going to dive into some potential legislative solutions to the preventable trauma and danger experienced by Trisha and far too many Black mothers. And in episode 3, we're going to talk about the New York Health Act as a systemic fix to this and so many other unfair and dangerous aspects of our broken healthcare system and outcomes. Let's get into it.
I later on found out that there were only at the time 5 Black OBGYNs in the entire city of Buffalo. Currently there's 4, and 2 of them do not deliver babies anymore.
See, Trisha knew all too well the disparities with Black maternal health, and so she did everything she could to find a provider she would feel safest with, but the system still couldn't deliver. The Dignity in Pregnancy and Childbirth Act, sponsored by Assemblymember Phara Souffrant Forrest of Brooklyn, would require hospitals to implement implicit bias training for perinatal care providers, inform patients of their rights in writing, and include pregnancy information on death certificates so we can better track the worst outcomes in maternal health. I will co-sponsor that bill. That being said, training alone won't fix a workforce crisis. The state's own Task Force on Maternal Mortality recommended SUNY scholarships for midwives and loan forgiveness for underrepresented providers in women's health back in 2019. That has not yet become legislation. I think it should be, and I'll work with champions in the legislature like Assemblymember Forrest to push this forward.
I think additionally, a lot of our hospitals should have doulas on staff. They should have women of color that can come in or can be on call, that can advocate on behalf of a patient. If the patient does not have a doula, but requests one right there on staff.
In addition to Trisha's on-call doula idea, which is terrific, right now, too many mothers can't even afford a doula in the first place. Medicaid started covering doula services statewide in 2024. That was a real step forward. But the reimbursement rates are too low to sustain the profession. There's a bill to fix that, and I support it. But if you have private insurance, it's likely your plan doesn't cover a doula at all. 6 other states have passed laws that require private insurers to cover doula care. New York hasn't. There's a bill that would change that. I'd co-sponsor it. There's also another bill that would change that and a whole lot more, but more on that in episode 3.
Again, there's a level of patience that you have to have in this birthing process. It's not always going to be quick. An hour isn't enough time, if looking back, for you to say, well, you haven't moved, your cervix hasn't dilated in an hour. But I've been here for 10.
When providers lack tools to monitor patients properly, they default to intervention. Bills pending in Albany would require Medicaid to cover blood pressure monitors for pregnant women without prior authorization and create a remote monitoring pilot for high-risk pregnancies. Better monitoring means more time. And in Trisha's case, time was all she really needed.
Yeah. Postpartum was hard. For about 2 to 3 months, my OBGYN, even though I filled out the survey, which asks you questions like, how are you feeling? You know, I answer the questions as truthful as possible. No supports were offered. So it was my pediatrician who said, here's what we're going to do. I'm going to give you the number for a therapist. I'm going to give you the number for some internal supports that you can reach out to. Let's also call. Your insurance has some options, your job has some options, and put me in touch with people that I could talk to talk through what I was feeling.
And monitoring doesn't end at delivery. Trisha filled out the postpartum screening honestly. Her OBGYN did nothing with it. It was her baby's doctor who stepped up instead. And thank goodness she did, but that's not a real system. That's just luck. We need a screen and connect standard. When a screening flags a mother in distress, the provider should be required to make a documented referral, not hand her a pamphlet and say, you look great, see you in a year. These are real bills that address real failures. I will fight for them. But I want to be honest. Every one of these bills exists because we have a healthcare system that sorts people into tiers of care based on who their employer is and what plan they can afford. Our next and final episode is about actually fixing that broken system. I hope you'll tune back in for episode 3 when we'll talk about the New York Health Act. Thanks.